Flexation, the movement that decreases a joint angle, like bending an elbow, for example.
Mom,
or it can be
you're
other.
just copying what you said in the beginning.
Okay, flexation is a movement that decreases a joint angle, like an elbow bending, for example. But it can be other joints as well, like a knee or palms. Its most common is at hinge joints. The extension would be the opposite movement that straightens a joint and returns to zero position. Protraction is the anterior movement of a body part in which the transverse horizontal plane is moving forward. Okay? And the opposite of that would be retraction, which is the posterior movement. Example, pushing a door open, then retracting it in its resting place after. Okay? Circumduction would be one end of an appendage remain still, stationary, while the other end makes a circular motion. Okay? Rotation would be like it can apply to any bone turning around a fixed axis. It is a movement in which a bone spins on its longitudinal axis. Okay? And supination, which would be like a palm being held forward, facing anteriorly or upward. And pronation would be the opposite movement, causing the palm to face posteriorly or downward. Abduction would be like doing jumping jacks. And that would be the movement of a body part in the frontal plane away from the midline of the body. An example would be the standing feet with legs apart or raising the arm up to one side of the body. The adduction part would be a movement of a body part in the frontal plane backward to the midline, which would be the reverse as you see her standing here. Okay, so finally, last would be the plantar flexation and the dorsiflexion, which would be the foot moved upward, which would be as if you were walking, your feet would be moving upward, and the opposite would be the plantar flexation, which is to push the toes down as if you were painting your toes, and that is to prevent you from tripping as you're walking. Okay. Thank you.